Rakuten is the smartest way to save money when you shop because you earn cash back at over 3,500 stores. Fashion, beauty, electronics, home essentials, travel, dining, concert tickets, and more. Your favorite stores like Lowe's, Levi's, and Nike pay Rakuten to send them shoppers. And Rakuten then passes on a part of that payment to its members as cash back. You're already shopping at your favorite stores. Why not save while you're doing it? It's a no-brainer. Membership is free and easy to sign up. Get the Rakuten app now and join the 17 million members who are already saving. Cashback rates change daily. See Rakuten.com for details. That's Rakuten. Your cash back really adds up.
Thank you for turning to 10, your news leader. 10 News Conference with Gene Valicenti continues right now.
Welcome back. Rhode Island Department of Health Director Dr. Jerome Larkin is in studio with me. Good morning, Dr. Larkin. You prefer Jerry?
Good morning. Jerry, yes.
We'll call you Dr. Jerry Larkin. You've been there since May.
Yep.
So it's coming up on almost a year.
Getting there.
Right? Do you have your sea legs? You feel better now than you did when you took over in May?
I've always felt good.
Yeah. You know, you were just going over, we haven't really had a permanent health director until Dr. Alexander Scott left us during COVID. After that, it was a series of interim directors, and now you're the permanent?
Right.
Yeah. Did that harm or help the department in any way? You were mentioning a lot of names we just went through.
Well, I think the agency is very resilient, and we had good leadership in our acting directors, as well as the devotion of the staff to the agency and its work. Yeah. So I would not say it harmed the agency, no.
You're post-COVID. I guess that's how we look at it. There's before COVID and post-COVID.
Yes.
And I remember Dr. Scott, she was on the news every day. I mean, it really propelled your department into the limelight. Now she's gone. And the COVID stuff seems like so long ago, and already people are railing against any new vaccine. I don't know anybody who's taken the shot that's out there. How do you feel about these new vaccines that are coming out?
Well, one, I have taken it.
All right, you're the first one I've met, actually.
Really?
But you know what I'm going. You know I'm getting at here. There's the reluctance to take any more vaccines. Why is that?
Well, you'd have to ask individuals themselves, but I think that in a lot of regards, people now think of it as a less serious problem. But I also think there's an awful lot of disinformation out there. People who have different sorts of agendas who are influencing people to not take it.
Well, what do you mean by that? RFK, by the way, is running HHS. He's got certainly a lot of concerns about vaccines in general, certainly this COVID vaccine. He's really going after Dr. Fauci. Every day on the internet, you'll read about concerns about heart problems and other problems. I mean, this is out there. Is it all disinformation?
Quite a bit of it is, yes.
Yeah.
The secretary has concerns. But I would say that we need to lead as public health leaders. We need to lead with science and with truth and what we think is the best for the public health.
You took the latest vaccine and the booster shots. You're up to date.
I am up to date.
If there's one to take, you've got them all.
Yes.
How do you feel?
Fine.
You feel fine? And you're dismissing any concern about heart problems and cancer problems and young people dropping dead in the news? Is that all just?
I'm not dismissing anything. Every vaccine has a certain efficacy and every vaccine has certain types of risks. By far, the benefits of the COVID vaccine outweigh any risk that has been attributed to it.
Well, the best endorsement is you took it, and you would recommend it to members of your family?
Yeah, I took it along with the governor, in fact, and the lieutenant governor.
All right. We're post-COVID. There are other things to think about. I'm going to talk about a list of local issues that you're involved in. But first, how do you feel about RFK Jr. taking over the federal? Basically, he does what you do on the federal level. Controversial. Very controversial. What are your thoughts?
I do not agree with his stance on vaccines. I believe they are misinformed. But again, leaders have to lead with science and with truth and with the best interest of the public in mind.
Right. Is there any common ground you have with him on fighting big food, for example? He says, well, there's ingredients in our food, they don't allow it in Europe, and big food is a problem, and that's why everybody is obese. Is there common ground?
I would have to examine his stance a little bit more closely before I could say there was common ground. I did not see a lot of common ground with him in what I did watch of the hearings.
How political is your job? You're appointed by the governor. How political is it?
My job is apolitical in the sense that my job is to serve the interests of the people of Rhode Island, whether they are Republican, Democrat, Libertarian, whatever their party affiliation or political views are. So in that sense, my job is completely apolitical. I would say it's political with a small p in trying to understand people's perspectives and understand what the effect the department or what I may say or do in any given situation.
Right.
So it's political in that sense, but it is not a political job in the sense that I'm a Democrat or Republican or what have you.
Okay, well, you have to work for governor, so it's involved somehow, and you have to answer to a legislature. It's involved. All right, let's get down the list. This is post-COVID. Is COVID behind us, or are you worried about new variants coming up?
COVID is not behind us. I think, again, we've transformed from a pandemic to an endemic disease. What I mean by that is that rather than a new entity that's infecting people, making them sick, is that we're going to see cycles of it every year. So about 4 weeks ago, we saw peaks in the amount of virus in wastewater.
Right.
That's actually declined significantly in the last 4 weeks. But I think every year there will be spikes of COVID. There will be an opportunity to get a vaccine to protect yourself, to protect your loved ones, to protect other people that you may interact with. Flu is actually spiking right now. There's quite a bit of transmission of flu. So I think COVID will be like other respiratory viruses. We'll see spikes every year.
It'll become just as routine as flu.
Yes, in a manner of speaking, yes.
Now, RFK, he just the other day talked about the flu vaccine. Came out against it. Believes it does more harm than good.
He's wrong.
He's wrong. Well, go ahead, say it. You're here in Rhode Island. Go ahead. Why is he wrong?
Why is he wrong? He's wrong because influenza is still a very serious disease, or can be. And the best protection you can give yourself against it is vaccine. Vaccines are inactivated. They really do not have any risk of causing flu itself. And while every vaccine is imperfect and has a degree of protection, and for flu, absolute protection sometimes runs 60, 70, maybe 80%, meaning that you won't get the disease. Its actual most powerful impact, and probably the most powerful impact of the COVID vaccine as well, is that if you do get the flu or you do get COVID, you have really dramatically reduced your risks of serious illness, hospitalization, or even death. And both of those viruses still can cause all of those things.
I get the flu shot. I get it on the radio. So
you should
I
get
have
the
a problem
COVID
with that.
You should get the COVID vaccine.
Well, listen, I don't think I'm alone in this. I'm a little reluctant to get the
I know
the
you're not
latest
alone.
COVID. I got 2 of them.
Okay.
I got 2. I'm not like an outlier here.
Okay.
I bet if you went and got the numbers on how many people are actually getting this latest vaccine, it'd be fractional.
The uptake is disappointing, yes.
Okay. All right, just as long as we establish that, not an outlier, it's fractional at best. All right, stay with us, because I want to talk about measles and bird flu and the hospitals and the lead registry that is important to you. And we'll continue with Dr. Jerry Larkin, the new director of the Rhode Island Department of Health. He's either a year in May. He's on 10 News Conference with us.
Bombas makes the most comfortable socks, underwear, and T-shirts.
Warning, Bombas are so absurdly comfortable you may throw out all your other clothes.
Sorry, do we legally have to say that?
No, this is just how I talk, and I really love my Bombas.
They do feel that good. And they do good, too. One item purchased equals one item donated.
To feel good and do good, go to bombas.com/Wondery and use code WONDERY for 20% off your first purchase. That's BOMBAS.com/Wondery and use code WONDERY at checkout.
This new year, why not let Audible expand your life by listening? Explore over 1 million audiobooks, podcasts, and exclusive Audible originals that'll inspire and motivate you. Tap into your well-being with advice and insight from leading professionals and experts on better health, relationships, career, finance, investing, and more. Maybe you want to kick a bad habit or start a good one. If you're interested in learning how to master your emotions and hearing scientifically backed advice for using your emotions as a tool, may I suggest Shift by psychologist and bestseller author Dr. Ethan Kross? Trust me, listening on Audible can help you reach the goals you set for yourself. Start listening today when you sign up for a free 30-day trial at audible.com/Wondery. That's audible.com/Wondery.
Welcome back. Dr. Jerry Larkin's in. He runs the Rhode Island Department of Health. I'm going to keep him for another segment. This is an introduction maybe to the wider audience who hasn't met you before. Yeah. Where'd you go to medical school and where are you from originally?
I grew up in Connecticut.
Yep.
I am married to a Rhode Islander, so now I consider myself a Rhode Islander.
Okay.
I went to medical school in New Jersey at Robert Wood Johnson Medical School. It's now called Rutgers Medical School.
Yeah. New Brunswick.
Yep.
And you went into, pediatrics, but you also had a specialty. And what kind of a doctor were you? What have you been doing before we tapped you for this?
So my postgraduate training, my residency training, was a combined internal medicine pediatrics. So that's where you spend a total of 4 years going back and forth between both departments. Mm-hmm. And then I had board certification in both areas. Right. And then I did a fellowship in infectious diseases for 2 years.
Okay, now why take this role? It doesn't pay, you can make a lot of money doing other things for universities and things like that. Why? What attracted you to this? Why'd you say yes?
A few different reasons. One was I've always had a strong belief in public service. I spent 12 years on the Tiverton School Board, so that was actually pretty good training for this job.
Okay.
I think that I was, being asked. So, the governor and Secretary Charest both had reached out to me, and I felt like they were people that I could really work with and would have a good relationship with. I had been in my position for about 18, 19 years, mm-hmm. and really enjoyed it, had great colleagues, and it was very rewarding. I did a combination of administration, teaching, right. patient care. But I was ready for a challenge of some sort, and I guess I got one.
I think you do. State government gives you a real challenge. I had Senate President Ruggiero in about a month ago, and he is pushing for a medical school at URI. I don't know if he wants it as part of his legacy, but he's taking it serious. Do you think that's going to happen? Give me an honest opinion.
It's really hard to say. There's a lot of things that would work against it. Would require an awful, a pretty large outlay of capital up front.
Hundreds of millions. I mean, to get this thing rolling at some point.
I don't have a number per se, specifically, but yes, tens of millions anyway. It would be a great long-term solution. I don't know that it's going to be a good short-term solution because you have a significant lead-up time from when you start to build the school to you get students there to graduate them, et cetera. I'm not sure I can tell you whether it will or will not happen, right. But there's a lot of things that would need to be overcome for it to happen.
Well, the idea is that let's train people here, and maybe these people will stay here and become primary care docs and stem that shortage. You're saying it's not that easy, that primary care docs, you can find them, you just have to pay them to stay here.
That's exactly right. So you could fill a medical school class with Rhode Island natives, mm-hmm. and educate them. They could do residency here, but they will always be attracted to potentially higher reimbursement and salary. It's in Massachusetts and Connecticut. They're dramatically different, and because we're such a small state, you can keep your ties to Rhode Island, but cross the border and practice at a much higher rate.
Perennial complaint I hear from doctors whom I know, and they say, I'm here in Rhode Island, I'm losing money. I could be over there.
It's a real issue.
What's your role in fighting that? Senator the White House last week told me that he's going to make sure that RFK Jr. knows that reimbursements have to be evened up, and it's a problem. What's your role in that?
Well, continued advocacy, making sure that the public is aware, that our politicians are, or that our legislature is aware. It's fundamentally an issue of federal reimbursement because what happens is Medicare rates are set by the Center for Medicaid Services, and those are lower for Rhode Island than they are for Massachusetts and Connecticut. And then third-party payers follow those rates based on a percentage.
Right. We have about 3 minutes left. I want to really bang through the list.
Sure.
Measles, 2 deaths in Texas. Yeah. Very rare. You're concerned about that?
Yes, I think that we all need to be aware and watch this outbreak as it evolves. We did have a measles case of one child, which was not related to that, and there was no secondary transmission in Rhode Island. But it is a very infectious disease. our school age rate vaccinations right now are at about 97%. That is a rate that does correlate with enough herd immunity that we should be protected. However, we need to keep up vigilance in making sure that we have widespread vaccination coverage because it can spread.
Measles, mumps, rubella. They still package those three?
Those are, yep.
But by the way, my kids got it.
Good.
They got the shot. Not an anti-vaxxer, just a little bit concerned about this latest COVID one for obvious reasons. Bird flu. Is that a problem for us here? We've had a couple of sporadic cases in animals in and around.
Correct. So we've only had a few outbreaks, or not even outbreaks, cases in poultry and one fox.
Right.
There have been no human cases in Rhode Island. There's only about 70 cases, or less than 70 cases, in the United States since the early 2024, and only one attributed death, and that was in a person who had underlying medical issues. Most cases have actually been pretty mild. So it's a topic to continue to be aware of, and we watch very carefully, but so far so good.
Opioids. The mayor told me just 2 days ago that the safe injection site is up and running in Providence.
Yep.
He says, so far no problems. The police haven't been called. Do you endorse that?
Yes.
Do you think that's a good idea? Because it's controversial.
No, I believe it's a good idea. It can't make anything worse, that's for sure.
Yeah, I mean, the idea is, well, a drug user would bring their drugs there, use it, shoot up, whatever term you want to use, and if they get in trouble, take too much, there's a nurse there or someone who's going to get them out of it with Narcan?
Yeah, not a nurse, but a trained provider who's able to administer Narcan and high-flow oxygen, and then summon EMS. The biggest risk factor for a fatal drug overdose is injecting or using the substance in isolation, so alone. If there's someone there who can undertake an intervention if one is indicated, that's protective.
Is it not encouraging drug use? Is it not looking the other way? Why is it so
Not at all.
controversial then? Why are we the only state to sanction one? There's one other in New York, and we're the first state to sanction one here. If it was such an acceptable premise, it'd be all over the place. Why is that, you suppose?
I think there's a lot of stigma still associated with drug use. One of the most powerful things we can do to help the epidemic is to destigmatize it.
About 30 seconds. Go ahead.
Yeah, that's I think why people are opposed to it. They're unfamiliar with it. It does not enable drug use because people are going to use if they're going to use. It is not, having the safe injection site available does not lead them to decision to inject. It leads them to inject in a safer environment.
Right. Well, the mayor said there's been no trouble so far, so that's good. It hasn't been in the news.
Absolutely great.
You have our lead paint registry. Just take about 15 seconds, then we're going to hold it there and let you get back to work. A lead paint registry?
Correct. So this is to allow renters to know if their home that they're renting is conforming with current laws regarding lead exposure to children.
If anybody wants to know more about that, can go to your website. Dr. Jerome Larkin, he's running the Rhode Island Department of Health. Thanks for coming in, covered a lot of ground.
Thank you.
And good luck up there.
Thanks.
This is 10 News Conference, your #1 longest running political show in Southern New England. A reminder, watch all of our interviews on turnto10.com. For now, I'm Gene Valicenti. I'll see you on the radio next week, 6 to 9 in the morning on WPRO, then right back here on NBC 10 News at 6. Have a good weekend.